The shoulder is the most commonly dislocated joint in the human body, occurring most often in young athletic people. New research from the University of Michigan Health System shows patients who have recurrent shoulder dislocations may benefit from surgical reconstruction using cadaver bone and cartilage to essentially sculpt a new shoulder.
I had come home from work, and I came home, I was a little tired, a little hot, so I took a drink and I laid on the couch. And 16 hours later, I was awakened and in a hospital. They told me that it was meningitis, bacterial meningitis. It appears that I'd had several seizures. Somewhere during that 16 hours, I fractured the shoulder.
Here at the University of Michigan, we've been looking at defects of the humeral head, which is the ball part of the shoulder, and the effects of those on recurrent instability following surgical repair. And we really looked at this biomechanically, and we've been able to show that certain lesion sizes are at greater risk. And we also came up with a novel technique to repair these lesions. The most common way to reconstruct or stabilize a shoulder joint is a soft tissue repair, which is repairing the capsule and ligaments that hold the joint in place. And this is very successful, but in situations where there's missing bone, the soft tissues see forces that are much higher than they can withstand, and they fail. This is the shoulder joint. This is the humerus or ball of the humerus. This is the socket, and this is called the glenoid. When a shoulder dislocates, it pops out this way and lies there, and you can see that the glenoid is hitting the humeral head, and you can see how that causes a defect, fracture or impression fracture right here. What I do is I actually take the injured bone and cartilage and reconstruct that as well as the glenoid. And when I reconstruct the glenoid, it provides a lot of bone stability, so that when you tighten the capsule to repair it, you have bone support, which is very stable. We've been very successful at this. We've been able to stabilize shoulders that have been dislocating recurrently and have even failed 1, 2, sometimes 3 surgical procedures, but not addressing the bone and cartilage.
It's been 8 months since my surgery, and my shoulders 100% full motion. There's nothing that I can't do. I mean, anything I could do before my injury, I can do now, and I can do it better.